That everyone in Uganda should be under a health insurance scheme sounds far-fetched, but this is something that is happening in Israel, where all citizens are under health insurance, either private or government. Now, lawmakers under the Health Committee and the Ministry of Health want a bill introduced in Parliament.
Important, we want to see if there are any areas of partnership with the healthcare system here, or some areas of sharing of skills in terms of training.
Commissioner in charge of planning in the Ministry of Health, Dr. Francis, believes the scheme is long overdue.
While the government is encouraged to put in more money, especially in building the infrastructure, money to pay the health workers will not come from government. It will never. So health insurance is something that we must put in place. Everybody has done it. We can do it. We are the same people with the same conditions in the region. Why not Uganda? Why the odd man out? Rwanda has it. Tanzania has it. Kenya has it. Burundi has it.
Yari Dango, an Israelite and chairman of King David Medicine Foundation, says 25 years ago, Israel, like Uganda, did not have an insurance policy for all. That has since changed. He says Uganda can change its course.
And to establish a national health law. This national health law basically provide basket of services, should be regulated as well by the government. The government now has to see how much money she can collect from this area. This is like some kind of a model. And then she has to decide what should be the cost of these services, and then to go and to ask the hospitals, private hospitals, governmental hospitals that you have in Uganda, then the budget can be expended by other income. Like the government can decide to contribute also money.
Buoyed by what they see in Israel, MPs on the committee say they will introduce a bill in Parliament to ensure that everyone is insured.
The first step is just this bill must be coming to Parliament. It should come to Parliament, and we should be able to convince our colleagues. We shall first of all write a report, and secondly, we should be able to now push Minister of Health and Cabinet to bring this bill on the floor of Parliament.
However, Dr. Francis argued that what should be done is to strengthen the country's healthcare system, improve its human resource, and also increase awareness about its importance.
Phased and systematic manner, because we have to educate the population. You will not just declare overnight that we are now going to collect health insurance money. Everybody must pay. Pay where? First of all, we have not put up the structures where money can be paid. Number two, you have not organized all the providers of services where these people can go to once they have paid. But we are going to start with the public sector. We are going to start with the public institutions, poor as they are. And we improve as we go along, because a number of people have been arguing services are very poor. What are we paying for?
To me, I feel it cannot work in our country. Well, it's good we've learned, but it cannot, because we will have the health insurance, and where are the facilities? First of all, look at the facilities that we have. The patients even pay.
Israel has one of the best healthcare systems in the world, and the MPs think that it's from here that they should borrow a leaf.
Now, this is an initiative that is being championed by the Ministry of Health, but also if it's brought into Uganda, it will see a number of lives of people who are needy really change. Maurice Ochol, NTV, Tel Aviv, Israel.